This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Welcoming a newborn to your family can be one of the happiest moments in your life. Yet the excitement is usually coupled with apprehensions and fears on the vulnerability of the baby. This is the reason why newborn screening, or NBS, has been instituted in the Philippines.
Newborn screening is a blood test that will screen newborns for congenital diseases, or what we call the inborn errors of metabolism. And most of these diseases can cause something as mild as a mild mental retardation or growth stunting, but can be as grave as death.
The process involves taking a few drops of blood from the baby's heel, blotted on a special absorbent filter card, ideally on the 48th to the 72nd hour of life. Most disorders are unrecognizable at birth, but with NBS, there is an opportunity to identify and treat affected babies when serious health problems occur.
You can save lives. Not only save lives for those for those children who would have the diseases that can cause mental retardation, you can help them live a normal life, not challenged mentally or physically.
What diseases can be prevented with this vital procedure? What complications may arise if a baby does not undergo NBS? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Carmencita Padilla, Director of the Newborn Screening Reference Center of the National Institutes of Health, UP Manila. Also with us is Dr. Mary Ann Chiong, Head of the Biochemical Genetics Laboratory Institute of the Human Genetics of the National Institutes of Health, UP Manila. You can join tonight's discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
It is Newborn Screening Awareness Week.
Yes.
And here on the show, we'd like to learn more about newborn screening. So what exactly is NBS? Dr. Padilla.
Yes. Newborn screening is a test that we offer to babies shortly after 24 hours of life so that we can identify conditions that can lead to mental retardation or death. And I want to qualify that we're not testing all diseases. We're testing for 6 specific conditions that can be reversed in terms of complications.
Dr. Chong, is this a new, how do you call that, test that's being offered in the hospitals? How long has it been being offered?
Yeah, we started in 1996, so that's how many years already, ma'am?
About 17
years.
More than 17 years now.
So it's not really new.
But in the Philippines, only 17 years, but worldwide,
more than 50 years. 50 years. 61 was the beginning of newborn screening in the US. That's where it started.
Why is it relatively new here in the country?
Well, it's very difficult to to start the program. You compete with a lot of priorities. But even in the US, they had problems starting this at that time. But I think we were able to start with 24 hospitals. We have 24 hospitals that actually started this in the Philippines way back in 1996. And we're happy to say that we have more than 4,000 hospitals right now offering newborn screening in the country.
So where is it available and who conducts NBS?
Actually, it's offered in every hospital because it's part of licensing. As part of the newborn screening law or the Republic Act 9288, every hospital has to offer newborn screening as part of a licensing requirement.
Okay. So whether you give birth at a private or a public hospital, this kind of test is offered to the parents.
Yes.
Is that right, Dr.
Yes.
Archon?
So as Dr. Padilla mentioned, it's available in all hospitals, and even lying-in clinics have it, health facilities. So for those children being born in the barrios, etc., in the far-flung areas, there is a nearby, I think, health facility that offers newborn screening in the area.
What is the significance of this procedure? Why is it important?
Well, these babies look normal at birth, and there are no symptoms. As a matter of fact, they go home without any problems. The problems come in only on anywhere from day 5, 6, or sometimes even at 2 weeks. So if you're not able to catch them in time, there will be a problem.
So within 24 hours, you're able to catch or able to detect any disease that the child might have?
No, we want to do the test shortly after 24 hours. Okay. The result will come out about day 5 or day 6. Okay, and that's enough time to catch the baby and give the right treatment at that time. If you do the test at 2 weeks, then you're going to miss some of these conditions and the baby may be very sick at that time.
Okay, so doctors will go back to this discussion. We have on the line Angela. Hi, Angela. Good evening.
Hi, Miss how are you?
Good, thank you. Please go ahead with your question for our doctors.
Yeah, I would like to know, is it enough that a newborn screening will be done only once, or should I get a second opinion?
Okay, thank you, Angela. Doctors, Dr. Padilla.
The same test is being done all over the country. So there are actually 4 labs right now. We just opened the 5th lab. So it doesn't matter which lab you go to because they're doing the same test. If there is a need for a second test, it's called the confirmatory test. It's not a newborn screening test. So there's a protocol for each one. So all they have to do is, if there's a problem, their pediatrician or midwife or nurse practitioner will be telling them what to do.
How's the information on NBS in the country? Is it talked about with your OB? Is it talked about with your pediatrician? How is the information given?
Well, ideally, the obstetrician should already inform the parents who are about to give birth, the mommies, pregnant mommies, during the prenatal care. They should already inform these parents about newborn screening. And the benefits of newborn screening, its importance, and then probably the pediatrician again, can reiterate, the significance of newborn screening once the baby is delivered. And I think during labor or probably upon delivery, these parents are being given brochures, which contain information about newborn screening.
Mm-hmm. And it is encouraged that every parent who has a newborn baby have their child tested for NBS.
Yes, because you don't want to have a baby who's retarded. You don't want a baby who dies of a condition that can be saved. So I think it's the right of every individual, every newborn to have a normal life. And that opportunity starts with that newborn screening.
Mm-hmm. What medical conditions have been detected because of NBS?
At the moment, we have 6 disorders that are included in the panel. Can I describe them? Or
maybe we can talk about one first. One first,
yes. Okay. So
the most common.
The most common among the 5 is actually glucose 6-phosphate dehydrogenase deficiency, or we call it G6PD deficiency. Okay. There is an enzyme in your red blood cell that is deficient. And when you are exposed to certain food or drugs, the RBC gets destroyed, and patients will present with jaundice or yellowing of the skin, and it can also lead to brain damage. Mm-hmm. So that's the commonest. I think 1 in 55, is that right, ma'am? 1 in 55 Filipinos.
And this is inherited from the parent, or does this develop as the mother is pregnant?
It's inherited. It's a gene actually that's usually it's found actually in the mother, but it can actually be present in the father. So I think it's just important to know that once you have this condition, you have to avoid certain food items and drugs. When you go to the doctor, they bring the list.
And the doctor.
But maybe, you know, maybe next, you know, we can talk about another condition later that's probably more fatal, and in a later segment.
Yes. How about those, let's say, you know, there's information given already and your doctor has talked to you about it, that, you know, NBS screening is very important. It can save your baby's life. But what about the other mothers who choose not to have NBS and may later on decide to have it when they've taken their baby home and it has been a couple of weeks already?
Well, you know, if, for instance, for some conditions, the critical period is only 2 weeks. So if you do that condition is congenital hypothyroidism, and after 2 weeks, the baby starts losing IQ points. If the mother decides to have a test at 1 month or 2 months old, that baby lost already several IQ points. The baby cannot recover that. So it's you can stop the damage, but it's there. So the important thing is that you do it at birth, and if it's positive, then you start treating the baby.
Okay, right away. Doctors, we have another caller on the line, Luisa. Hi, Luisa. Good evening.
Hi, good evening.
Hi, please go ahead with your question for our doctors.
Hi, good evening. My question is that, is it possible to detect something from my baby even if we don't have a history of disease in the family?
Thank you, Luisa. Dr. Padilla?
It is possible. You don't. Some of these conditions have parents who are carriers. Actually, that's what you call a recessive condition. So you're not going to pick up any history from the family, but it's because the gene is passed on to the baby, and the baby may have problems. So our recommendation is that any baby, regardless if there's a family history or no family history, newborn screening must be done.
But emphasizing the benefits of getting NBS. We can't emphasize it enough. And since this is Newborn Screening Awareness Week, we'd like to inform them more about the benefits of NBS. Dr. Padilla?
Actually, it's not just the mothers. I think the mothers and grandmothers can ask for newborn screening. The mothers, the fathers, the titas, the lolos, and the lolas. But we'd like to reach out also to the professionals who are listening, that it is their responsibility to offer it to the babies they're taking care of. So it's part of the Republic Act 9288, wherein the professional who's handling the baby is responsible for offering it to the baby.
Dr. Chong, would you like to add to that?
Well, I would just like to say that early diagnosis will, plus early treatment, of course, because if you diagnose them early, you will be able to treat them early. If you do it early and give treatment early, these patients will live normal lives. No? So the affected children can have normal lives because of newborn screening.
Dr. Chong, Dr. Padilla, we will talk more about newborn screening when MedTalk returns.
Did you know that 4 infants can be saved every hour from mental retardation or death as a result of newborn screening? According to the Department of Health, or the DOH, as of December 2010, more than 2 million Filipino babies have undergone NBS, saving them from imminent sickness and death.
We're back here on MedTalk, still talking about newborn screening. So doctors, what are the other disorders that can be detected because of NBS?
Okay, so one is congenital hypothyroidism. There is a missing hormone. Congenital, and you don't see any symptoms until much later in life, several months. Okay, the CAH, or congenital adrenal hyperplasia, for the classical type, they can be dead within 10 days. Okay. Phenylketonuria and maple syrup urine disease will need a special milk formula. to be able to become normal, and the other condition was G6PD deficiency. But I do want to mention congenital hypothyroidism, because in the world, if there is one condition we want to be tested in every baby, it's going to be congenital hypothyroidism. Studies have shown that you have to start treating by 2 weeks. After 2 weeks, you lose IQ points. And I think, this picture is, tells us all. This poster is actually found in every hospital. Okay. And this poster shows a baby, not a baby anymore actually. The girl was about, okay.
Okay.
The girl was about 7 at the time this was taken. The boy was 14. Okay.
Okay.
Okay. And as you can see, the boy is retarded, and the girl is normal. The difference here is that the girl had newborn screening done and was treated. The boy was picked up at the age of 14 and was severely retarded. But the boy is alive. I just saw his pictures the other week. He's 20 plus by now, and of course severely retarded. So that is the impact of newborn screening. You can change the future of the baby. Like, look at the future of the girl. The girl is normal and probably in college right now. And the same condition in the boy, and the boy is severely retarded. There's nothing I can do about the retardation at this point.
Mm-hmm. But just because of NBS, just because of newborn screening, you're able to save the life of the girl, and hopefully a lot more parents would be aware that this is the result of NBS.
Yeah. Actually, right now, I think the program has saved more than 60,000 babies already. But just because we've had newborn screening for the past so many years. And we can save more.
Dr. Chong?
Oh, I think there's one more disease, ma'am. Galactosemia.
Oh,
so there are 6, no?
Yeah,
Total of
6.
6.
So
okay.
galactose is a sugar that is predominantly seen in your dairy products, no? So when a baby is diagnosed with galactosemia, we just change the milk. The treatment is as easy as that.
Okay. Now, doctors, we'll just go to our Facebook question. Okay. Does newborn screening hurt? Are there any other methods aside from pricking my baby's heel? Of course, this is a concern of the moms, no? Yeah. How will it be painful for the baby?
Yeah, heel prick is the most convenient, I think, and the easiest, no? When we do, these tests in that age group, no? And it's similar to your immunizations. Like at birth, they are being given hepatitis B vaccine on the thigh and vitamin K injection. So it's similar to those injections.
So the baby's heel is pricked?
Yeah.
And then what happens to the
So I think we just get like a few drops of blood, and then drop it on a special filter paper, and then we just dry it and send it to the laboratory, to the newborn screening facility. Yeah.
How long after do we get the results of NBS?
If it's positive, they would get a phone call maybe by about day 5. And then if it's normal, it will join the ordinary mail. But the physicians, there is a coordinator in every hospital. Every lying in, every birthing center, every hospital has one coordinator who handles all of the results. So if there's a positive case, this coordinator will inform the pediatrician that they have to recall the patient. And we have recalled patients even up in the mountains.
Oh, really?
Yes.
And they really come and they really
Well, if they don't
pains.
come, somebody will go get them.
Yes.
That's good to know. Yes. Another question from Twitter. My child has a health condition. Will my next baby have it too?
I think it depends on the condition. No? 4 of those conditions can recur in each pregnancy 25% of the time. No?
Okay.
So it depends on which condition. Yeah. But I think most of them are inherited in a recessive manner, as what Dr. Padilla mentioned. And if it's an autosomal recessive pattern of inheritance, we presume that both parents are carriers of the gene. And the condition can happen again 25% of the time each pregnancy.
All the more they should get NBS screening
Yes.
for each child.
Yes.
Yeah. Mm-hmm.
Another question, doctors, from Twitter. How accurate is the standard newborn screening?
The methods that we're using is the same method that's being used in more than half of the labs in the world. Okay, so We do follow international standards. There's an international accreditation by CDC Atlanta, Georgia, and we have to pass those tests just like any other lab in the world. And I'm proud of the labs here because they perform very well and are comparable with the other labs in the developed countries.
How about those who give birth at home?
Well, right now what's happening is they can go, if the rural health unit has it, they can have it done there. Otherwise, they have to go to a facility or any hospital that's offering newborn screening.
So upon getting the results of newborn screening, let's say the baby has been tested positive for the disease, for any of the 6 diseases that you mentioned, what is the next step for the parents? What should they do next?
Well, when the positive result comes out, then the pediatrician will arrange a referral to a specialist because we have very few specialists in the country. And if, let's say, the patient is coming from a distant place, then we will link up that physician with a specialist in Metro Manila, Cebu or Davao, and arrange the treatment of the patient.
What normally happens after that? Are there more tests conducted, or are there medications already given or administered, Dr.
Yeah,
Chang?
so after the first newborn screening and it turns out positive, we proceed to the confirmatory testing. And then if the confirmatory tests, again, are still positive, then we start treatment. No? I think, for 3 of those diseases, we just treat with changing the milk formula. And these are also, again, being given free by the program, by the newborn screening program. No? So, yeah, we treat right away once the confirmatory test turns out positive.
Does the child outgrow this? No, because it's inherited. No?
Yeah.
It's just controlled.
Well, you reverse the complications. You don't have retardation, you don't have death. There are many issues, like even if the problem, I think, is you have to be compliant with the treatment. So some parents, from my experience, is when they see that the patient, their baby is normal, sometimes they stop the treatment on their own. That's very dangerous. So there's a reason why they have to be matched with a physician who knows exactly how to handle the case.
Is it expensive to undergo NBS and to continue on with the other tests?
It's covered by PhilHealth right now. The cost is 550 pesos for the 6 diseases. I did mention that we're going to 28 diseases by January. But if they're members of PhilHealth, then there's no payment because it's just covered. Okay. But if they're not members of PhilHealth, then it's an out-of-pocket. But I always compare it with, the desire of a parent to know the sex of the child. I know that they spend actually to get an ultrasound, and then if the sex was not shown, they want to repeat it again. But here is another opportunity for the baby to be normal, and that's to set aside 550 pesos for the newborn screening test.
So if you're not a member of
PhilHealth, they have to save for it.
They have to save for it, and it is not factored in with the hospital bill.
No, there's a separate. No, it's not. It can be part of the hospital bill, but then if they're a member of PhilHealth, then it can be claimed from PhilHealth.
Yeah. Okay. It's actually part of the newborn package of PhilHealth, including your BCG vaccination, your Hepa B. No? So, yeah, newborn screening is part of that package.
So, doctors, any other advice to the parents out there? I know that in the country, NBS has only been here for 17 years. And what do you say, or what can you say about those who already have the information on NBS and who still want to know more, and to those who aren't aware of NBS yet? How can you encourage them to read up on it and be more guided on how to go about doing this?
Well, I think every baby has the right to a normal life. And since the babies look normal at birth, it's very difficult to ask for specific tests. And I look at newborn screening as an opportunity to have a good start with life, because if one is positive, then you can change the future by being treated properly and then being normal. So my advice to parents is that don't hesitate to have newborn screening done. The pain is very minimal. I will not say it's not painful, because there is pain, but the rewards are great if the patient is positive. I'd like to talk to to the grandmothers, because I know that they participate in the decision making. They should ask for it. They should make sure that if it's not offered in their hospital, that they should ask for newborn screening for the baby, because that's for the future of the baby.
Thank you very much, Dr. Padilla. Dr. Chong?
I think I'd like to ask also the help of our health professionals, no? And to encourage newborn screening, no? To offer it to their patients. Because I think they know already the benefits, so they should emphasize it to their patients, no? The obstetricians and the pediatricians, I think they should offer newborn screening because the benefits are great, no, for the baby.
Okay, thank you very much, Dr. Chong. Thank you once again, doctors, for helping us understand more about NBS and its importance, really, in having our children tested for NBS. Thank you once again.
Thank you.
Again, we'd like to thank Dr. Carmencita Padilla and Dr. Mary Ann Cheong for enlightening all of us about our topic for tonight. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.